An intimate understanding of facial anatomy is essential to avoid potentially devastating complications from soft tissue filler injections. In this video, we'll review the mandibular topography. This refresher will help reestablish the necessary lexicon required for our larger discussion of facial injectables. The mandibular body is a horizontally curved portion that creates the lower jawline. The rami are two vertical processes located on either side of the body. They join the body at the angle of the mandible. The angle of the mandible is also called the gonial angle. At the anterior and superior aspect of the ramus, we find the coronoid process, and the posterior is the condyloid process. These two are separated by the mandibular notch. The temporalis muscle and the masseter insert on the lateral surface of the coronoid. Superior to the angle of the mandible is the mandibular tuberosity. Near the apices of the premolars is the mental foramen. The most superior aspect of the alveolus is called the alveolar crest. On the medial surface of the mandible, we find the mandibular foramen, through which the inferior alveolar nerve and inferior alveolar artery enter, and subsequently course through the mandibular canal. At the posterior-inferior aspect of the mandibular foramen is the mylohyoid groove, against which the mylohyoid vessels run. Below the mylohyoid line is the submandibular fossa. It's the location of the submandibular gland. And a more shallow area above the mylohyoid ridge, in a more anterior location, is the sublingual fossa, the location of the sublingual gland. And then distal to the molars is a triangular depression called the retromolar fossa. On the anterior view of the mandible, the external surface contains the mandibular symphysis at the midline. Inferior to the incisor teeth is a bony concavity called the incisive fossa. It's the origin of the mentalis muscle. Immediately inferior to the incisive fossa is a midline convexity called the mental protuberance. The most prominent point of the protuberance is called the pogonion. The lateral edges of the mental protuberance are elevated, forming the mental tubercles. Facial retaining ligaments are important to understanding concepts of facial aging and rejuvenation. They're located in constant anatomic locations where they separate facial spaces and compartments. Descriptions of the retaining ligaments are variable in the literature. Today, regarding the mandibular retaining ligaments, I'm referencing the work done by Kang, and Nam in 2016. This paper reported 3 separate ligaments, and I'll show the location and name of each of these ligaments and display the average morphometric location found in that paper. The first is the mental ligament. The next is called the medial mandibular ligament, and the final is referred to as the mandibular osteocutaneous ligament. The purpose of these ligaments is to act as anchor points, retaining and stabilizing the skin and superficial fascia to the underlying deep fascia and facial skeleton in defined anatomic locations. Another critical anatomical landmark for the facial injector is the location of the mental foramen, and depending on ethnicity, the mental foramen can be located between the second premolar and the first molar, as in Tanzanians, or more anteriorly and in line with the apex of the second premolar, as in the Japanese. And in Caucasians and Jordanian races, it's usually observed more medially, between the first and second premolars. But despite its anteroposterior variation, the vertical location variation is only within a few millimeters. It can be found between 12 and 15 millimeters from the inferior mandibular border.